Hi everyone, I am Dr. Prathyusha, working as an obstetric consultant. Today I would be talking about diagnosis of pregnancy and how early can it be diagnosed. The basis for diagnosis of pregnancy is the presence of HCG hormone. HCG hormone is secreted by syncytiotrophoblastic cells of placenta and it is secreted into the blood and blood of mother and fetus. HCG hormone is secreted both in urine and blood. It is secreted as early as 3 to 4 days after implantation in case of blood, whereas it is secreted about a week after implantation in urine. So, the urine pregnancy test test can diagnose pregnancy as early as 2 days prior their missed period to 1 week later after they have missed period, depending upon the levels of HCG hormone in urine. Whereas a blood pregnancy test or a beta HCG helps in diagnosing pregnancy 3 to 4 days prior to their missed period, and it is more sensitive in diagnosis of pregnancy. Thank you.